Welcome back, West Michigan. You are watching Alive and Well. I am Linda Balkema, and this is Melissa Ferguson. Melissa is a health education specialist, correct, for Planned Parenthood, and she works here out of the beautiful First Congregational Church. We have been talking about breast health because it is Breast Cancer Awareness Month, and Planned Parenthood, of course, offers, is it free screenings?
Usually, I mean, if someone is uninsured or low income, can definitely qualify through one of the programs. So.
Sure. So that's wonderful. So it's another resource and a place you can go so you can have a well woman checkup. In addition to the breast screenings or mammograms, there's other services provided there. I know they do the entire physical for the women, so that's wonderful to have that resource in this community. So Melissa does a lot of education on sexual health, STDs, sexually transmitted diseases. Tell me, that's a big concern here in Muskegon County, unfortunately.
It is. Actually, and you can kind of use these words interchangeably, but the language that's most common now is sexually transmitted infection. They've decided that that's a bit more accurate, that not all these necessarily are diseases. The good news is in a lot of the literature, it's all still used interchangeably. I think the word VD is kind of fallen by the wayside, but we still use STD and STI pretty interchangeably. So, and that's part of the education too, is letting people know, hey, this is what we call them now.
Well, and there's a reason for that, of course, because when we think of disease, you think of the word disease and you think, ooh, this is kind of like leprosy. But disease doesn't necessarily, an infection is much different than a disease. So I have to get used to that new terminology too. I'm old school, see? Right. Okay, so you educate a lot of youth on sexually transmitted infections. Good. Give me a little example when you're, for instance, talking to young people. How do you approach this?
Yeah, one of the lessons we do is specific just to sexually transmitted infections, and we do a whole separate lesson just on HIV. So that's such a big deal that we do a whole separate lesson just on that one alone. But we first start out by having the kids brainstorm, like what are ones you've heard of? And sometimes it might be a slang or a version of what the name of the infection really is. And we make a list, and while they're brainstorming them, I don't think they realize, but I'm grouping them on purpose. So I kind of either put them on one side of the page or the other, or down towards the bottom. Once we get our list, if they don't complete it all, I kind of fill in the gaps for them, and then try to get them to think about, why do you think I have all these grouped together? And you have HIV, herpes, HPV all on one side, and they may usually say, they all start with H. And I'm like, okay, that's true, yes, but these are all viruses, and viruses are in your body forever, and you can treat them, but they're not curable. And then the other side, we have the bacterial infections, which can be much simpler to get rid of, a trip to the doctor, a test result, and then some antibiotics. And then we have the third group at the bottom, which are kind of the parasites or the bugs, we tell them. So, they kind of get to see the different kinds, and, some of them might say, if you had to have one, which would you choose? And I was like, well, I guess I would really, something bacterial just because it's curable.
It's curable,
So then it starts getting them having those conversations about specific diseases, and if I had this one or this infection, what should I do? And kind of hammers home the point of, wow, there's a lot out there I didn't even ever hear of.
I was just thinking in my mind, as you said, tell me something you've heard of in the slang terms and all that. And the first thing that came to my mind, the clap. I mean, do the kids still use that terminology?
They do, actually, and that's probably one of the funniest things that I teach them, because they always yell that out, and they always think it's chlamydia. And the clap actually refers to gonorrhea, and the way that they used to test for that back in wartime. So I always tell the kids a little funny story, and they're all, I'm like, think twice before using that word. Now they're like, it's not even the chlamydia. It sounds like a C. It should be chlamydia. I'm like, you're actually talking about gonorrhea, but at least you knew one.
Yeah, at least you knew it. And that's interesting, because chlamydia is one of the, I think, that is on the highest rise here in Muskegon County, as I understand it. I believe there's a lot of efforts to do further education and prevention due to the rise in chlamydia here.
Yeah, I would say I think one of the reasons that the grant that the Safer Choices Project is funded by came to Muskegon specifically because of our high incidence rates of sexually transmitted infections, specifically your gonorrhea, chlamydia, and syphilis. Muskegon's currently, with like the 2011 statistics, the most recent ones they had, are at the number 10 as far as Muskegon County.
In the nation or state?
The last one I saw was in the state of Michigan.
Okay.
We were up there pretty high, so we have made our way down. I have heard that we were 2 at one point, or
I
number
heard that
4.
Also, yeah.
So the fact that on paper it's saying we're down to number 10 means we're making progress. People are getting tested. People are getting treated.
That's really good. And I understand there was supposed to be a new database or something that was going to be set up where people could anonymously. Is that true? Is there anything?
I know with the health department, all like doctors' offices, anybody that does any testing needs to report. It's anonymous, but it's reported cases, so they can kind of get a handle on the scope of is this turning into an epidemic? Where are we at with it? Are we making progress?
Okay, so that's more from a clinical aspect. That's not personal people
Not
that
not
just
that I'm
get on
aware
and
of,
can-
but
okay.
it could be. I feel like there's new things I learn every day.
Well,
so.
there's always new programs out there, but it's important if somebody is concerned, and young people, if you're watching this show and you are concerned, because there are so many different things, and it is highly possible to contract chlamydia, contract. You know, that's a tricky one too. Okay, so you could contract one of these diseases. I know a lot of young people think, well, I didn't really do that much. You know, it doesn't take much, and that's probably an important message. And if you could go ahead and tell them how the simplest ways of contracting these infections happen, and also where they can go again to.
So one thing that we always tell the youth when we're working with them, we also do some community events where there's parents and youth that come to it, so the parents will get the message too, is that, you know, kind of defining what is sex. You know, there is no definition. Yes. Each person might think something counts that doesn't, and we're not here to decide for you what counts and what not, but we care more about you understand what things put you at risk, what activities can put you at risk. And I make sure I always let the students know that there's, you know, a good handful of those infections that we just wrote on the board that you can catch from intimate contact. There doesn't have to be anything that a lot of people would consider sexual activity. If there's, you know, skin-to-skin contact or any exchange of body fluids, regardless of penetration, definitely a risk for infection. And even with your scabies and your pubic lice, your crabs, just sharing bedding, towels, stuff like that, there's even a risk. So letting them know that just because you don't think you're doing anything that could put you at risk, you really might be. And we're seeing a huge rise in oral sex in teens, and a lot of them think, hey, that's safe because we can't get pregnant.
And they don't consider it sex.
They
I
don't.
know. I've had this discussion with my own kids, and I have a son who firmly believes, he's a college student, says that's not sex. Okay, I'm not going to decide that for you, but you're still putting yourself at risk.
Yeah, so we talk more behaviors as opposed to, you know, they ask me, what do I think? It doesn't matter if I think something is, I think that, I'll tell them, I think that if you do that, you could, you know, be at risk for this, this, and this if you were not using protection. So we kind of discuss like the behaviors and, you know, things that will put you at risk or not at risk. It's not this is bad or this is good, but this is a risky behavior, or this is, you know, ups your chance for contracting one of these.
This is safe and this isn't. It's about if there's intimate contact, it's important that they realize they could be at risk.
And I always talk to them too about how since the numbers in Muskegon County are so high, this is the, you know, population, the people that you're coming in contact with. Why does this affect you? The statistic is 1 in 2, so just a regular average, not just for Muskegon. Young people by the time they're age 25 will contract a sexually transmitted infection at some point in their life. So if we're talking 1 in 2, you know, I split the room down the middle, and they always want to be in the opposite half. Like, oh, it's that side of the room. And we even do a little activity with cups of water, and they pass them around to make new friends and swap water, and then they put a pH strip in and find out if they, you know, their test comes back positive or negative, and then they start thinking, oh, where did it come from? How did it pass? And that gives them a great, like, oh my gosh, wow, I only talked to this one person, but
how many people did that person
was
talk
with
to?
this many people before me, and they kind of have this, oh, wow moment. So it's kind of a cool way for them to see as opposed to just, you know, giving them information, you know, infections are, you know, everywhere, be careful. They can kind of see how it spreads and how quick those things can move, and how you might only be with one person who was with, you know, however many people, and it goes quickly. So I always let them know how common it is, and it's not a death sentence. You know, even HIV these days, you know, that when things are caught early is really what we emphasize. Regular testing, then you can get treatment. You know, responsible behaviors if you test positive, so that your partners can get treated. So you can get treated, maybe different behaviors in the future, so we're not infecting future partners, and just trying to get them to get over that being mad or angry with someone. And okay, well, how would you feel if you didn't know? You know, like, what should you do once you're done being upset about it? You know, it's not a death sentence. Most of them can be cured with antibiotics. The others, you know, very manageable treatments.
Sure, and that is so important because it does come with a lot of stigma, a lot of concern. So so we want to make sure that anybody out there, you know, regardless of your age, that you feel comfortable. You can come down to Planned Parenthood at the health department. 209 East Apple Avenue. Okay, and do they just walk in? Is there walk-in services?
Walk-ins are available. To minimize wait time or anything, calling and making an appointment. They have their set hours, but a lot of times they'll be flexible on that too if that doesn't work for you. But the big thing is just, you know, calling and getting that appointment so you can get tested.
Okay. Well, obviously your education program sounds wonderful. Now, are you working with all the area schools or just certain schools right now?
So far we've been, Safer Choices have been done at 6 locations in the community. I'm currently at the Juvenile Detention Center, which is up towards Whitehall. So that's servicing youth from obviously all over the county. I've run 2 programs there. Last year we had a program at Muskegon High School, one at Muskegon Middle School, both middle schools, Bunker and Steel last year, which is now Muskegon Middle School. We did the summer school programming, so all the kids that had summer school, if they weren't in the gardens, they were having Safer Choices as one of their classes for summer school. And then juvenile detention. So, and then did I say Webster House Youth Services?
No,
so
Webster
over
House,
spring
okay.
break, we ran a program at Webster House. Since those kids were going to be around and not have their normal school program, we came in and kind of did a short little week-long workshop with the youth there.
Now, how about people that live in outlying areas, or if they wanted to come to this education, or their parents wanted them to come to this education, can they sign them up through one of the places that you're currently doing the programs?
Yeah, they would be able to come. Usually what we do is on the website we have information for the Safer Choices project, lists contact email, phone number, and if somebody had 4, 5, 6, 8, 10 youth and they were like, hey, I would like, my cousins and nieces and nephews to take this, they could call me up, we'd set it up, and we get a program going. So it's not just that there's necessarily just set times and locations. Sure. Someone has a Girl Scout troop and they're like, hey, we'd like you to come in for 3 weeks. We could set it up. So
Safer Choices program, and I'm going to put you on the spot website.
Yep. So you can go to the Planned Parenthood website, which is www.ppwnm.org. And then if you go through there, you'll see links to education, Safer Choices program. The
Safer Choices program. You probably can just Google Safer Choices program Muskegon.
Yep.
And it'll bring it right up, and that's a great resource. I would like to see every student in Muskegon come and get this education. It sounds like a really good program, and I'd like to sit in on one of your programs sometime.
You'd be more than welcome.
Come back and film that. Of course, then we have to get permission from the parents, but maybe we can get a group of students, because that would be very visually effective for our viewers too. Okay, well, thanks, Melissa. We're going to take another short break, and we'll just reiterate everything we've talked about and keep you posted.